Hi, I'm Dr. Caroline Fisher. I'm a consulting psychiatrist in primary care. Well, I'm the member of the team you probably won't see, the provider you won't get to see, because my job in collaborative care is to actually review patient charts and help the primary care doctors determine what good treatments are. Collaborative care is an evidence-based practice that completely changes how we deliver psychiatric care. So rather than the old way where you go to the psychiatrist or you go to your primary care doctor and say, I've got a problem, and then the primary care doctor says, okay, let's send you to a psychiatrist, this is a different approach. So what happens now is if you go in and you say, I've got a mental health concern, or my child has a mental health concern, my assistant, my psychiatric assistant, will call you and within a day or two get you in for a thorough data gathering, and they ask you like a million questions. And then put that in your chart for me to read. I read that plus anything else in your chart that might be relevant, and then I put together some treatment options and I send them to your doctor. You then meet with your doctor who knows you, and the two of you together decide what you want to do about the problem. A few weeks later, my assistant will again call with a standardized outcome measure, and the standardized outcome measure is really just a way of making sure that we understand, are you getting better or not? Because if you're getting better, then whatever treatment that you and your doctor chose is the right treatment. But if you're not getting better, it comes back to me, and then I have to come up with some new ideas that then get sent back to you and your doctor to think through until you get better. And when people have looked at this model, what they've discovered is that many, many more people get better than the way we used to do it. And that matters to me. That's what I like best about it, is that we keep changing the treatment until we get the success you need. There are three reasons that collaborative care is better than treatment as usual. And the first one is timing. This can get done fairly quickly, which is really not an option when we're referring outside. Someone can have a look at your chart and give good treatment recommendations and get you on the path to healing within a couple of weeks. The second one is that you stay with the doctor who knows you and that you trust. And together you work with your primary care doctor to find the solution that's best for you and your family. The third one is the outcome measures. The outcome measures are probably the most important, because when they looked at who gets better and who doesn't, what they found is that often people fall through the cracks. They didn't like the medication, they stopped taking it, or they were referred elsewhere and the referral didn't go through, or something happens. This way, we are keeping track to make sure that we know that you are either getting better or we can try harder to find you something that works. Primary care doctors only get a little bit of training in psychiatry because they get a lot more training in other things that you see in primary care. Psychiatrists are trained for 4 to 6 years solely in psychiatric problems, so we're going to be better at it. I attended residency at University of Massachusetts and did a combined residency in adult and child psychiatry. And then from there, I went on to do things like I was the editor of the Corvallis Child Psychiatry report for a long time. So I'm in a much better position to look at the literature, to synthesize what is really going to work, and put those treatment recommendations and lend that expertise to the primary care doctor. I make a variety of recommendations. I try to recommend anything that has evidence behind it that I think might help you get better. So that might be therapy, online programs, self-directed programs, behavioral changes. I try to keep up on the literature around complementary and alternative therapies, because I really want there to be a broad spectrum of things that can help you get where you want to go.